CVS, Walgreens, PharmEasy, Amazon Pharmacy, and NetMeds didn't just build apps. They built a $200 billion pharmacy empire. But how did they become the kings of medicine delivery? What game-changing problems did they solve? And what was the secret sauce that made them unstoppable juggernauts? Let's decode the billion-dollar strategy behind the biggest pharmacy apps on the planet and how you can replicate it for yourself. The healthcare market is big and profitable, but scattered. Healthcare is the only industry where demand never stops. People always need meds and continuous care. Yet before these giants took over, medicines, tests, and consultations all happened in different places. It was slow, inconvenient, and outdated. Pharmacy apps solved this fragmentation and delivered one seamless experience. How pharmacy apps quietly took over healthcare. 1. CVS, the one-step-at-a-time empire. US-based CVS didn't build everything on day one. They started with just one thing: simple prescription refills. Then came insurance syncing, walk-in clinic integration, and later home delivery. One focused step at a time. That's how they became one of America's most trusted healthcare apps, serving 100 million-plus users today. Walgreens, the sequential dominator. Walgreens began with easy vaccine bookings, then added digital health records, med reminders, and same-day delivery. They built trust slowly and scaled massively. Do you still have an opportunity to beat these pharmacy behemoths? The question should be, can you? Of course you can. Google was the sole dominant player in search results until a startup, OpenAI, entered the market and disrupted its monopoly. So, yes, you've got a huge opportunity to become the next billion-dollar pharmacy app because despite these leading pharmacy app names ruling the industry, there are huge gaps that remain unsolved. 1. Chronic care is still not unified. Pharmacy apps don't offer end-to-end chronic care: meds, labs, doctor, and monitoring. Patients still jump between multiple apps to manage long-term diseases. 2. Medication adherence is poorly solved. Reminders are basic and ineffective, leading to missed doses and refills. No app provides real adherence tracking, caregiver alerts, or AI-based nudges. 3. Real-time inventory accuracy is still broken. Users frequently face out-of-stock issues and last-minute order cancellations. Apps lack a true hyper-local real-time pharmacy inventory network. 4. Insurance and cashless integration is still messy. Claims, approvals, and coverage checks remain manual and confusing. No pharmacy app offers seamless, automated in-app insurance workflows. 5. Zero personalization in care and pricing. Everyone gets the same experience regardless of their health needs or history. There are no personalized care plans, predictive refills, or tailored subscription models. Make a move now because this market won't stay open forever. Users are still testing different apps. No one has locked the entire market yet. If you're thinking about launching a pharmacy app, now is the moment. Partner with aPurple to build an app that stands out, wins user loyalty, and stays ahead of the curve.